Hello everyone, I'm David and welcome back to another first aid skills video. And this week's video, like I said last week, is I'm going to be going over kind of the scenario that I did in last week's video. So let's get off right away. So the first thing that happened, I skipped that whole first part, the coming up to scene safety, asking for AED and 911, that kind of stuff. And so we started off with doing chest compressions. So we're doing our chest compressions. And then our AED showed up. Now, probably the most important thing in resuscitating someone is an AED. So what we want to do with the AED is we want to get it on this person as fast as we can. So we don't want to just keep doing CPR and then get to the AED after we do our cycle. We want to get it on them and go. If you're alone, like I was in my scenario, you'll just have to stop compressions and set the thing up yourself. If you have someone else that's working with you, one of you can continue to continue compressions and breaths while the other person works around you and puts pads on while you continue working on the person. So what we did is we took our scissors. This shirt was on, and we cut the shirt off. So the AED pads will not work over clothing. They have to be on direct skin. So things to keep in mind is, depending if it's male or female, on the privacy you want to give them. Because we are taking off clothes, try to give them as much privacy as you can. If that's having someone hold up a blanket, to block public from seeing, trying to get so the public maybe doesn't watch quite as much. They're not really going to know because they're not in a state to notice. It's just respectful though to give them a little bit more privacy. We didn't have that problem here because our person has no chest hair, but a lot of chest hair will get in the way of these pads. So if they have a ton of chest hair, AEDs typically have a razor. So we want to just shave a quick shave. You don't want to be careful and try not to cut them. We just want to get all the hair off. So clearly don't try and cut them, but just a quick shave in the spots where the pads are going to go, done. So then, I'll turn it on in a bit just because it's really loud and it might talk over me. So we turn it on, next, after we shave, there's a few more things we want to look for before we actually get to pads. Jewelry, make sure if there's any jewelry, it's not going to come in contact with the pads that we put on. And also keep in mind for medication patches, we don't want the pads to go over any medication patches that the person might have because it can cause a burn. So take those patches off if they're going to impede with the pads. Just make sure you're wearing gloves when you do that so you don't absorb the medication that's in the pad. And pacemakers, keep an eye out for a pacemaker. So if you look on the chest, you might see a scar or a raised hard area or a bump on their chest. That could be a pacemaker. So just make sure when you put the pads on, they are at least an inch away from that pacemaker. Okay. So we turned on the AED and it asked us to apply pads to patient's bare chest and to plug in pads connector. So that's this connector right here, and it plugs into that hole right there. So when we open up the pads, we see the pictures on this one are kind of worn out because it's one of our trainers. You can see it kind of tells you where they want the pads to go. So if we take this one off and take a look at it, that one goes bottom left of the person. So that one sticks right there, just like that. And if we take this one off and look at it, it's kind of worn, but it goes right up top. So right up here on the upper chest. Just like that. So that's what it's going to look like with the pads on. Now, once those are on and we plug in the connector, I'm going to turn it on now so we hear what it's doing again. And if it overgoes my voice, I'll just try and talk a little louder. So we'll turn it on.
Apply pads to patient's
So we applied the pads.
Plug in pads connector.
And it's flashing.
Next to flashing light.
So we plug that in. Boom.
Analyzing heart.
So it's analyzing. So while it's analyzing, we don't want to touch the person because then it could read the movements that we do as a pulse. That is a not shockable rhythm. So while it says charging,
shock now. Press the orange button.
That is difficult to do. So when it's analyzing, don't touch the patient so it can read something proper. The AED will shock what is called ventricular fibrillation and ventricular tachycardia. So tachycardia is the heart's going too fast to do anything right, and fibrillation is it's very erratic. So it might run okay for a bit and then just kind of be totally random, which is not a good rhythm, and that's what these are looking for. Now, when it says do not touch the patient charging, at this point, if you want to listen to it, you can for that one. You can just sit there and let it charge. But if you want to do compressions while it's charging, you're not going to get shocked until you hit that button. And at that point, it's done analyzing and it's just building up power. So we want to have as much on time as we can. So if you're doing compressions while it's charging, and then it says shock, then we want to back up. We want to make sure no one is touching any metal that this person might be on, or the person in general. So we say, I'm clear, you're clear, we're all clear. That's just kind of a general thing you can say to make sure that no one touches. And then you hit shock. Now, as soon as you hit shock, that shock is in and gone. So if you hit it, now they're safe to touch. So it's not like the shock sits there and lingers and waits for you to touch it to get shocked. As soon as you hit that button and it delivers the shock, once it's shocked, it's good. And so then it will tell you straight into CPR, and that's when you jump right in and you start doing your 2 minutes or your 5 cycles of CPR. Now, in that last video, it was a little longer because I went along with that full 2 minutes, and then it kicked back in and said no shock advised. That's just what our trainers do. It may want to do another shock, it may not. So that's basically it. AEDs are fairly simple. Just make sure you put the pads on right, remember what to look for, and then at the very minimum, just follow its instructions. It'll tell you exactly what to do. So that's it for this week's video. Next week, I'm going to cover how to use these pads and considerations or an AED on a child or infant. So I look forward to seeing you all in that video. Thanks for tuning in.